Officials in various Canadian cities with big COVID surges right now are changing some recommendations to try to help slow the progression of the second wave. There's a lot of talk about the social bubble, that small group within which you can interact without physical distancing. Well, we are hearing many people discourage that now in Montreal, in Toronto, from the national level as well. And that is the starting point for our conversation this morning with Dr. Samir Gupta, who is with me this morning, as he always is on a Wednesday. And I'm glad to see you, a respirologist and associate professor in the Department of Medicine at U of T. Good morning, Dr. Gupta.
Morning.
From Toronto's Chief Medical Officer, Dr. Eileen de Villa, bubbles no longer reflect the circumstances in which we live, quote unquote. Mayor Valérie Plante, in the mayor of Montreal, one family alone, that's it, in a bubble. Dr. Tam, a tweet from her, hashtag downsize your bubble. What is changing and why in terms of the guidance on social bubbles?
The reality is that we're seeing daily case numbers that are very similar to the first wave. And we were in phase one, and we were enacting very strict social measures and lockdowns during that wave. Yet here we are, and many parts of the country are still in phase three. So the government hasn't quite caught up to the reality that we're seeing out there. And I think this is a situation where the public has to lead, where the government is lagging. People carefully sort of curated their bubbles over the summer with one or two other families often. But what's happened now in the fall, as people go back to work and as kids go back to school, is that by definition, those bubbles cease to exist, because when you enter a room with 3 or 4 other people, you are by definition expanding your bubble to all of the people in their bubbles. And if those kids are in school, it means that your bubble now contains 20 kids in each of those other kids' classes, for example. So by definition, the return to school, return to work, the change in the environment with reduction of some of these limitations that we had in phase one has caused everybody's bubbles to expand. And now that we're seeing case growth again, bubbles have to shrink back to basically your household contacts. I completely agree with Valérie Plante's advice that we have to go back as if we're in phase one. We're in another wave. This pandemic is back, and we have to behave as if we're in phase one again.
Okay, because that's very clear. There is a lot of confusion, I think, about how to handle the bubble. So you're saying, Thanksgiving is coming up again, another time. We've just gone through the Jewish high holidays, big family gatherings. This would be the thinking. So it is one address, one family. We should shrink our bubble to that level.
Absolutely. Everybody should do whatever they can to do that. And there are exceptions. There are essential workers. There are exceptions to that. But people's philosophy needs to go back to phase one, back to what we had in that first wave and in March, and do everything you can to limit the number of contacts you have with other people.
No dinner parties, no overnights, no social interaction, since that is where these cases are coming from. That is tough medicine to take. All right, well, think about that. I have a couple of other questions for you. The big announcement from Ottawa that had procured nearly 8 million rapid COVID tests. These are the Abbott rapid tests, procured them, although these tests are still not approved for use in this country. So what good does that do?
Yeah, so this is an interesting test, and it's like many other point-of-care tests. It'll give you an answer, I've heard, in as little as 13 minutes. The FDA has approved many of these tests. Health Canada hasn't approved a lot of these tests. And, there's been a lot of discussion about that, and Health Canada has faced a lot of criticism for that. The first thing I'll say is that the FDA is not exactly a shining example of what a regulatory agency should be doing right now. They've made a lot of mistakes during this pandemic. This test is a game changer if it's out once it comes out. My guess is that there's probably some communication between those two branches of government. Health Canada has been looking at this. They have a scientific and apolitical process, and I think Canadians appreciate that. My guess is that this is probably going to be approved if it's been acquired in this way. That's my hope. Once this comes out, we want to see it rolled out extensively, because the current situation is just untenable. You have people with symptoms who possibly have this virus who are just not able to access the test. And that's a very harmful situation that we're in.
Certainly health experts like yourself have been very critical, as you suggest, for the slow pace on this, and the opposition at the political level saying that it's taken too long to get this done And I'm wondering what the potential consequences of a delay, if it does in fact come online, as other G7 countries and other Western countries have done, what price will Canada pay for slow approval here?
Yeah, I mean, I think the first thing to be clear about is that we do have our own regulatory regime here, and I think I appreciate that. People appreciate that we don't just follow the FDA. We have our own process. Usually those decisions coincide, but there have been drugs and tests that we've approved that they haven't, and vice versa. And it's important to have an independent process. That process is scientific. It's not influenced by the politics of that are surrounding this pandemic right now. But the other side of that coin is that the current situation is untenable. There is a lot of harm, as you say, from people not being able to get a test. And although this isn't the perfect test, there are false positives with this test. If it's not done within a week of symptoms, there are a significant number of false negatives with this test. So, it's not the perfect test, but it's much better than the current situation. And so the longer we wait and the longer people who have symptoms, potentially who have this virus, are not able to get tested, I think the faster we'll see the growth of this pandemic, because those people are not self-isolating. They're not taking the measures that they would take had they known they were positive.
One more, because here's another tool in limiting the spread. This is the app that the federal government has put out that is downloaded, we know, by almost 3 million Canadians so far since it was released. The COVID, it tells you if you had an exposure to someone else who's also downloaded the app on their phone. 3 million downloads, Dr. Gupta. Quebec is about to go and bring the app online. It was concerned about some privacy issues, but it is going to bring the app into Quebec. 3 million downloads, but only 514 users, Public Health tells CBC News, have notified the app about positive test results. And only in Ontario, so nowhere else in the country. 3 million downloads, 500 reports. It's all about the honor system. How is this working in your view?
Yeah, so the app has been one of the big disappointments for me with this pandemic. As you said, we've had 3 million users. There are more than 20 million smartphones in the provinces that have adopted this app. So the uptake is really low. We also have, only 500 people who have indicated in the app that they have the infection. And we know looking at the numbers that many more people than that who have the app would have had the infection by now. So people are kind of forgetting that they even have it. They're not using it. This concept of tracing has been the big Achilles heel of our response to this pandemic. It's a complex thing to do. You get diagnosed with this virus, you have to think back on everyone you've been in close contact with for the last 14 days. And public health has to then contact them, isolate them, and test them. And that's a complex thing that we don't have the manpower for. And that's been a big reason for this pandemic growing and coming back now in a second wave. And here you have a technology that basically does that for us, yet we haven't seen uptake. And there are a lot of reasons for that. There are countries in the world that have mandated people to use this, and they are seeing the benefits of it. We're a liberal democracy. We don't force people to do things like that. But I think it could have been rolled out better. There could have been a better marketing strategy around it, make it more enticing for people to use. And I think the private sector then has to pick up where the public sector can't mandate this. But, workplaces, companies could have said, you can't come back to work if you don't have this app. Universities could have said that to kids. Restaurants could say, you can't dine here. We're protecting our employees and our patrons. So I think the private sector still has a role to play.
Dr. Gupta, it's always most illuminating to talk to you on Wednesdays, and I appreciate the conversation this morning. Thanks a lot, Dr. Samir Gupta from Toronto.